when we're thinking about, the conversation with the extraction and ridge preservation, right? Do you do that grafting after every extraction, or how do you actually decide when are you going to graft? And
It's a good question. I mean, in an ideal world, I always treatment plan for an extraction along with alveolar ridge preservation. So that's something that's automatic, that we say that is. Now, whether the patient is going to accept that treatment or not, that becomes a different conversation, which relies a lot upon education of what we're trying to accomplish. I feel that you should. You should do it to alleviate potential problems, whether they be loss of volume of bone that is going to then make secondary treatment, prosthetic treatment, more difficult, or that it's going to contribute to periodontal problems with adjacent teeth. And so that's kind of how we address it with the patients, to get them informed of what the ramifications are if they don't do treatment. What I also like to let them know is that we are trying to open up a window of opportunity for them. And that window of opportunity is not forever. And we explain that to them. We say, even if we do graft today and you wait 10, 15 years to do anything, the chances are you're going to have resorption of that bone at some point. But we're going to end up in a better situation than we could be if we didn't do anything at all. The only times that we don't really do it is in situations of large infections. And so that would be if I have a patient that comes in, has a large chronic infection that there's suppuration, we're not going to graft at that point. We're going to get things, clean everything out, and then usually what we're going to do is we're going to wait, maybe do a delayed grafting if we need to, or we might end up at that point letting them heal and coming back and seeing what it is. But those are kind of unique situations. Most of the time we can get to a point that we can graft at the time of extraction, and that's my preference. Absolutely, it should. There was talk all the way back in 2012 with Gordon Christensen talking about that it should be standard of care. It hasn't got to that point yet, which really amazes me, but we're pretty darn close. And I feel in my practice it is how I am going to treatment plan every patient that's going to lose a tooth. They're going to get some sort of replacement graft. Yeah.